If you have chronic kidney disease, there are 5 home remedies and supplements that can help you lower your creatinine levels. They can help reduce bad cholesterol, lower blood pressure, and ultimately improve your kidney function. If this sounds too good to be true, don't worry, I'll show you the science behind what I'm saying. There are studies and published data showing that the 5 home treatments in today's video can truly support your kidneys. I'll tell you exactly what they are in just a minute. There was a comment, "The video about beating kidney disease is the best thing that ever happened to me." I started using the recipes and recommended fiber supplements, and in less than 6 months, my creatinine level dropped from 3.71 to 2.2. I'm in stage 3 now, and this is the first improvement I've seen in years. I pray every day because this is truly a miracle from God. Now, I'm not sure if I should keep using the supplements recommended in the book even though I'm in stage 3 and I can eat more fruits and vegetables. I tried reducing the fiber supplements, but I got constipated. What should I do? Hi Jason, this comment really made my day. I'm so happy about your recovery. But please keep doing what you've been doing because very few things actually work to improve kidney health. So if you found something that works, stick with it. And please keep us updated on your recovery. Let me know if you continue seeing improvements. I'll answer your question in more detail in the next part of this video. So today, we're going to take a deeper look at the supplements that may help you recover from kidney disease, and why they work. Let's start with the 5 most powerful home remedies and supplements that are actually proven to benefit people living with kidney disease. And since this supplement helped Jason so much, let's start with it. Supplement 5, Fiber Supplement. For most people with kidney disease, fiber isn't the first thing that comes to mind when thinking about improving kidney health. However, there are many published studies showing how fiber, a natural compound found in plants, can help strengthen the kidneys and improve kidney function. There's evidence to back this up, so using supplements like Metamucil, Citracel, and Fiberol can actually be beneficial. There are even psyllium husk supplements, the main ingredient in Metamucil, which you can find on Amazon at a lower price. But before you rush to Amazon or your favorite supplement store, it's important to understand why you need fiber and how it helps your kidneys, because there are also side effects you might want to consider. Dietary fiber is one of the key elements that all healthy diets have in common. 2 studies published in the International Journal of Nephrology showed that higher intake of dietary fiber is associated with lower risk of inflammation and mortality in kidney disease. Dietary fiber also helps reduce inflammation and other causes of death in chronic kidney disease. Another recent study published in the Journal of Renal Nutrition in May 2013 concluded that increasing fiber intake in CKD patients, through foods enriched with fiber, i.e., fiber supplements, can lower serum creatinine levels and improve eGFR. These 2 studies show that getting enough fiber is essential to help your kidneys. By reducing inflammation in the kidneys, they can function more effectively. This is great news for anyone with kidney disease. So, spread the good news. Hit the share button and send this video to anyone you know who's dealing with kidney disease. This might really help them. Yes, they might want to know that simply adding more fiber to their diet, through the foods they eat and with supplements, can significantly improve their kidney function. Now, the best way to add fiber to your diet and lower your creatinine is by following a kidney-friendly diet. Many fruits and vegetables are rich in fiber, so if you can, eat more plant-based foods to boost your fiber intake and improve your kidney health. You'll find that some fiber sources are both healthy and low in potassium, such as apples, pears, broccoli, cabbage, and more. I've talked about how to add more high-fiber, low-potassium foods to your kidney diet in my videos on the healthiest foods for kidney patients. You can watch them by clicking here if you want to learn more. And don't forget to subscribe and hit the notification bell to get updates on my next videos. So, increasing fiber intake through your diet is a fantastic way to improve your kidney health, and that's a fact. There's a long list of proven benefits associated with consuming more fiber, such as better blood sugar control if you have type 2 diabetes, lower cholesterol, and ultimately, improved kidney function. Now, there's just one problem. The recommended daily intake of fiber is 25 to 50 grams. That's how much you should be consuming every day. And when I tell people they need to eat 25 to 50 grams of fiber per day, they look at me like I'm from another planet. It's hard to grasp how much fiber we're actually talking about here. 25 grams of fiber is quite a lot. You really need to plan your diet around that number if you want to lower your creatinine levels and regain some kidney function. For example, one apple contains about 2 grams of fiber. You get around 4.5 grams if you eat it with the skin. And an apple is considered a good source of fiber. A single carrot has only 1.5 grams of fiber, and a cup of kale gives you about 2.5 grams. So, it's no surprise that the average American consumes only 5 to 15 grams of fiber per day, much lower than the recommended amount. What do we learn from this? First, never peel your apples. Second, find ways to add more fiber to your diet. Very few people actually reach the proper daily fiber intake. Here's a question for you watching right now. Are you getting enough fiber each day? Do you peel your apples? Let me know in the comments. As I mentioned, getting enough fiber can be difficult depending on how many fruits and vegetables you eat daily. But to make this easier, you can also consider using fiber supplements, which come in pill and powder form. Metamucil, a psyllium husk supplement, is one of the most popular options and can help with both high cholesterol and high blood sugar. It's available as pills, powder, or wafers. However, as I said, you can find other brands of psyllium husk supplements that may be cheaper than Metamucil and offer the same benefits. The recommended dosage ranges from 5 to 20 grams per day, usually taken with meals. But it can have side effects, especially at high doses, such as gas or bloating. So don't start taking any supplement without consulting your doctor first. Another recommendation is to gradually increase your fiber intake. Don't jump to the maximum dose on day 1. These supplements are generally safe but can interfere with the absorption of other medications like some antidepressants, heart medications, anticonvulsants, lithium, and may affect blood sugar levels in diabetics. So, always talk to your doctor before starting anything new. Now it's time for number 4. This one isn't as well known as fiber, but it's especially helpful for those in stage 4 and 5 of kidney disease. The best part? There are studies showing it can delay dialysis for up to 4 years if used correctly. Number 4, amino acids. What are amino acids, and why are they useful for lowering creatinine? You might have heard of amino acids as supplements for athletes or bodybuilders, right? Well, the amino acids that kidney patients need are a bit different from the BCAAs and EAAs used by bodybuilders. In fact, there are special amino acids made just for kidney patients that have been proven to help, especially those in the advanced stages of kidney disease. These amino acids are called keto acids. But why do you need amino acids, and how can they improve your kidney health? Amino acids are the building blocks of protein, like Lego blocks for our body, except on a molecular level. So, think of protein as a Lego wall, and the blocks are amino acids. When you eat protein, your body needs to break it down into amino acids to use it. I know this metaphor might be a bit too simple for many of you watching right now, but I really needed to explain why amino acids are helpful, okay? So let's hold on to this idea of blocks because it'll help us understand why amino acids can help. Protein is made of amino acids linked together like Lego bricks, right? So amino acids are the individual blocks. As supplements, they're especially useful for patients on a low or very low protein diet, because they can make up for the lack of dietary protein without putting extra stress on the kidneys. Because, as we know, protein metabolism puts a lot of strain on the kidneys. The more protein you eat, the more waste gets produced, and your kidneys have to work harder to get rid of it. Most of this extra work comes from the waste produced when your body breaks down protein into the amino acids it needs. With healthy kidneys, this extra workload is no big deal. But if your kidneys are damaged, any extra work just speeds up their decline. So clearly, if we take single blocks instead of the entire wall, the workload on the kidneys will be much less. In fact, several studies confirm that a low-protein diet can help restore kidney function. This is a proven fact. Protein metabolism places a heavy burden on the kidneys, so eating less is better, right? This means kidney patients need to limit protein sources like meat, poultry, fish, eggs, dairy, and more. But how much protein should you limit? According to several studies, CKD patients need to reduce protein intake to 0.6 g per kilogram of body weight per day, or even 0.3–0.4 g if aggressive management is needed. This means you really have to cut back a lot. I've talked about this in many of my videos on kidney diets, so check those out if you want to learn more about low-protein diets for kidney patients. Now, the problem is that cutting back on protein can lead to malnutrition. This isn't just a far-off theory. According to researchers, at least 1/3 of CKD patients are malnourished. The kidney diet is extremely restrictive, and between limiting potassium, phosphorus, and protein, it's really hard for patients to eat enough each day, right? And because of symptoms like loss of appetite, nausea, and vomiting, many CKD patients tend to eat even less than they should. The issue is that when you're malnourished, you may experience symptoms like weight loss and muscle mass loss, but also muscle cramps and weakness. And clearly, your kidneys will also be affected. Because malnutrition is linked to infections, right? Malnourished patients have a much higher rate of infection, and infections are very dangerous for people with chronic kidney disease. In short, this state of malnutrition is something you absolutely want to avoid if you want to lower your creatinine levels. One way to help address this is through supplementation with special amino acids. These amino acids are called keto acids, a type of amino acid supplement not intended for bodybuilders, but for kidney patients. Using them alongside a low-protein diet reduces the workload on your kidneys because they don't need to break down the protein. The amino acids are already broken down. Because your kidneys don't like protein, but your body still needs it. This is a compromise that can work, and you can make it even better with these special amino acids. So to get the benefits of a low-protein diet and avoid malnutrition, you can use these amino acids. Now, unlike fiber supplements that you can easily buy on Amazon.com, these amino acids should be prescribed by a doctor or a dietitian, as they need to be specifically adjusted for your condition. So if you're following a low-protein diet and think you're at risk of malnutrition, remember, there's a solution. Our next home remedy can help keep your heart healthy, boost your immune system, and support your kidney health by better balancing your gut health. And that is number 3, probiotics. Alright, we've reached the top 3. These supplements can give you some truly important results if you want to repair kidney damage. Probiotic supplements, in particular, have been found to be helpful in reducing urea in non-dialysis chronic kidney disease patients. These are findings from a very recent study on probiotics in kidney patients. But what does reducing urea mean? Blood urea nitrogen, or BUN in your lab results, is a key marker of your kidney function. Urea nitrogen is a normal waste product in your blood that comes from breaking down protein in the food you eat and from your body's metabolism. It's usually removed by your kidneys, but when kidney function slows down, BUN levels go up. Now, the patients tested in this probiotic study were found to have lower urea levels, meaning their bodies were better able to handle uremic toxins, reducing the load on their kidneys. What I'm saying is that probiotics have been scientifically proven to reduce the workload on your kidneys, giving them a chance to improve. And that's not all. Probiotics have even more benefits for your kidneys, helps balance the good bacteria in your digestive system, prevents and treats diarrhea, may help keep your heart healthy, and can ease symptoms of certain digestive disorders. It also supports your immune system and can help with weight loss and belly fat reduction. Now, these benefits are especially valuable for people with kidney disease or any other chronic condition because it's incredibly difficult for them to maintain a perfectly balanced gut microbiome. That's because probiotics are beneficial bacteria that live in your gut. When they become imbalanced, due to stress, antibiotics, medications, lack of sleep, acid reflux, or constipation, it can lead to a long list of health issues. So, if any of those factors sound familiar, probiotics might be exactly what you need to improve your gut and kidney health. Because, as we've seen, it's nearly impossible to improve kidney function without proper nutrient absorption. And your gut can't absorb the right vitamins and micronutrients from food when the gut bacteria are out of balance. What's more, when you have fewer good bacteria, harmful ones take over, which significantly increases the risk of infections. Just like with fiber, getting more probiotics from your diet is definitely an option. Yes, eating more probiotic-rich foods can help. These sources include yogurt, especially plain Greek yogurt, kefir, a fermented milk drink, fermented vegetables like pickles or sauerkraut, and more. The problem with some of these foods, though, is that they may contain high levels of sodium, in the case of sauerkraut, or phosphorus, in yogurt, which makes them less suitable for kidney patients. That's why probiotic supplements are often a better option, especially for those in later stages of kidney disease. These are the same types of supplements used in studies I've mentioned earlier, and they're shown to deliver the best results. Most studies showing benefits use doses ranging from 1 billion to 100 billion live microorganisms or colony-forming units, CFUs, per day. If you shop on Amazon.com, you'll find several brands offering 50, 60, or even 100 billion CFUs per serving. So you can just take one serving a day, or split it between morning and evening, to get the full benefits. These supplements are widely used and generally considered safe. However, side effects are still possible. Probiotics can trigger allergic reactions or cause stomach discomfort, bloating, or gas, and they may interact with medications. So as always, talk to your doctor before starting any new supplement. Alright, now it's time to move on to our number 2. This one has actually been proven not only to lower creatinine levels, but also to fight heart disease, lower cholesterol, and even reduce cancer risk. It's omega-3. One of the best supplements for kidney health. Omega-3s are responsible for most of the health benefits associated with a seafood-rich diet. In fact, few nutrients have been studied as extensively as omega-3 fatty acids. They come with a long list of benefits, all backed by research. Omega-3 can protect against heart disease and stroke, improve sleep quality, support bone and joint health, reduce liver fat, and may even lower the risk of cancer. It fights inflammation and helps reduce memory decline in older adults. These are major benefits, so it's definitely worth considering adding omega-3 to your diet. The best part? Omega-3 fatty acids have been shown, through multiple clinical trials, to lower high blood pressure, one of the leading causes of CKD. There's also evidence that they can reduce proteinuria, triglycerides, and inflammation in people with kidney disease. In long-term double-blind clinical trials, this supplement even slowed the progression of kidney disease in patients with IgA nephropathy. So how do you get more omega-3? The best way is to eat fatty fish at least twice a week. The great thing is, the most omega-3 rich fish are often the cheaper ones, because omega-3s come from fish oils, and oily fish tend to be less fancy. We're talking about mackerel, herring, sardines, anchovies, and salmon, some of the healthiest fish around. You can also find omega-3 in chia seeds and flax seeds. But if you don't eat a lot of fatty fish or seafood, a supplement might be your best bet. In fact, most studies on omega-3 benefits used supplements. According to the FDA, consuming up to 2,000 milligrams of combined EPA and DHA per day from supplements is considered safe. So all you really need to do is get some omega-3 capsules and take them with a meal. Just remember to speak to your doctor first. Omega-3s can act as blood thinners and may have other side effects or interactions. Always check before starting. And now, our number one today. This is a powerful home remedy you can make yourself with just a few easy-to-find ingredients. It's my secret detox tea. This is a super simple recipe with major benefits for your kidney health. I've made a whole video on this, so be sure to check it out. That's all for today. Thank you so much for watching.